I think this is the only podcast that's being recorded on a day of, no, the day before Thanksgiving. I think everybody's chilling by now, guys. Like, look
Oh
at you.
yeah.
Practice owners, startup founders, acquisition people, like working their butts off. Right, Tyler?
That's right. We had an emergency walk in and didn't say no. They wanted to pay cash, so here we are.
Okay.
Let's
Let's
go.
go just quickly, guys, if you don't mind. How long you've had a practice for?
Yeah, let's go in order of how we acquired. So Riley, I guess you could start off.
Yeah.
So my wife and I bought a practice about 8 months ago in the Knoxville, Tennessee area. And I must say that even though I was the first to buy a practice, I definitely was not the first to be interested in doing it. And I would not be here without these guys that motivated me to do it. So
That's awesome. Who's
Yeah.
next?
100%. We all graduated in May of 24, which was what now, 18 months ago or so.
Yeah.
I bought a practice in May in Pocatello, Idaho. We all are from Idaho originally, but I'm the only one back here now. And yeah, same for me. I have stood on the shoulders of these guys since day one.
So, Tyler, how many months ago? Can you do a math for me, please?
Yeah, it was 6 months last week.
Okay, awesome.
Okay, and then it was me. And Tyler and I were looking at practices about the same time. I was just a month behind him in June, so I think I'm at about 5 months now. Yeah. And yep, I would echo what these guys say. I mean, it was they got me through dental school and they got me into practice as well. So yep.
Yeah, I'm just a wannabe among these fine gentlemen. I am the newest practice owner. I bought my practice about a month and a half ago. It was October 17th. So I'm just a moocher. I've been mooching off of these guys, and they're genius, and been learning a ton from the mistakes that they make and the successes that they have. And even with the mistakes they make and warn me about, I'm making the same mistakes and probably more. But it's been a fun ride, and just working through the initial pains of the transition, but super excited about ownership. It's what we've all been dreaming about, and I think we're all just, at the end of the day, grateful that we're in the position that we are.
For sure.
How many of you
It's
guys in a text group?
this is it, I think, right? Just the four of
Okay.
us?
Yeah. Yep.
Yeah.
Us four.
For
Okay.
now.
The group's name is called Teeth Boys.
Okay. I think, Trevor, you and I were joking about it with Curtis. Like, if he was the last one without a practice, I can imagine the amount of dunking you were getting, like, on a daily basis. Like, dude, how long are you going to be working for that practice XYZ? Like, get your own office. Come on.
I know. Yeah, it's about damn time. Yeah, it's nice to not be the oddball out now. It's fun that we all are in this boat together at this point. So
It made things worse, Tiger, that he was in Alaska, so he was on a different time zone and didn't participate in the chat too much. So we would just bag on him all the time.
Man, I
I
can't
was just
imagine.
depressed up in the darkness of Alaska. So I took a little bit of a different route, and I right out of school went up to Alaska and was doing a lot of implants, full arch surgery stuff, and with the idea of trying to get as clinically experienced as possible prior to practice ownership. We all kind of took similar but separate paths, and at this point, within a year and a half of being out of school, all are in this ownership boat now. So
Guys, if you don't
Yeah.
mind, let's start there. You're in a dental school, right? You're about to graduate. And I'm going to bring you back and forth a little bit. I'm curious, what are the misconceptions that now you know there are misconceptions that are people telling you while you're in a dental school? From clinical to business to anything. Like, what was that?
Riley, you were the first one to buy a practice. Let's get your take. I'd be curious to hear what your thoughts are as far as, because you made the dive first. So what were your thoughts on, you kind of beat out the status quo and just went right to it. So
Uh, Yeah, I don't know. I feel like there's so many misconceptions about it. So, and it's hard too. Being in dental school, you have all these, 2-3 times a week, you have these corporate offices that are coming in and telling you about how great corporate life is
Yep.
and how much money that they'll throw at you. And they bring in Chick-fil-A in as starving dental students. We're going to be there, so we're just inundated with this. The temptations of corporate dentistry, and so that's I think that's a hard thing to look past when you're hungry.
And so that's a one misconception that corporate dentistry is the way to go.
Yeah.
Okay. And why do you think it's a misconception? Like, if you don't mind. And then everybody can jump in, because this is like the largest
Yeah.
podcast I've ever done. Like, I don't know how to manage 5 people on the same thing. But like, why is it a misconception? Is it because not that many people want to do that, don't want to do it, don't follow? Why is it a misconception?
Can I?
Go for it, Trevor.
Okay, sorry, I was gonna jump in there if you had something to say, but I was just gonna say that like there's not really a need for private practices to go and canvas dental schools, and so I think that you get a lot of the people, like the demand is there for these corporate offices. They need a lot of students coming out of school. They need a lot of workers and dentists to fill into their practices that they're acquiring or starting up, opening. And so we don't really get a lot of private practice exposure as a general body of dental students. Now, our education was a little bit different, Tiger, because we spent the first year together in Idaho before we went over to Creighton, and we all of the dental professors that we had there were private practice guys, and so we got quite a bit of exposure to that in the first year. Went around to a lot of different offices, talked with specialists, and just got a lot more exposure than I'm sure the general Creighton student body did. And so I think, being long-winded, bringing it to a short-winded situation here, that we don't get a lot of exposure in dental school to much else rather than like public health or corporate dentistry.
Mm-hmm.
Yeah, I think with that, it's super tempting. Like Trevor was saying, as a dental student, you have spent all these years in school accumulating debt. A lot of people had debt from undergrad already. And so when these corporate offices come in and they say, yeah, we're going to give you a $40,000 sign-on bonus. We're going to pay for your moving truck to come up to North Dakota. We're going to, whatever it is, what did they say? They're going to pay you $195,000, or the last associate they had is going to made $250,000, and you can make $250,000 too. Like
your gym membership.
A lot of people have
I got that one.
Yeah. If you haven't had any exposure to private practice, there's no context to put that in, and so it just sounds really, really good. Like, oh yeah, 250 sounds great. Well, I'll be honest with you. Like, I think we all learned the first year that like 150, 250, when you're looking at all these loans, it's really
Not much,
right? And so it sounds really good. We had so many classmates, like Trevor was saying, we were really blessed to be able to have a lot of exposure to private practice, but so many who had never talked to a private dentist before in their life. And so they're like, yeah, I got to go work for Aspen Dental. Sorry, I'm going to name drop. Because they're going to pay me all this money. And it's like, okay, we happen to know that there is a different way that is going to be better for you and for your pocketbook in the long run. But that's a misconception. Like, people don't even know that. And so if you don't know that, then those offers sound great.
Totally. Yeah. And to piggyback off of what Tyler's saying about all the debt, I think that's another misconception on top of, people not realizing how much you can make as a private owner versus working at a corporate office. They also you're told, like, oh, you're going to come out with so much in debt, which we do, we all come out with lots of debt. And so a lot of people have this misconception of, oh, I better go to the corporate world and work for several years to pay off my debt, and then maybe I can buy a practice. But at the end of the day, if you can just jump into private practice sooner rather than later, you can get your loans paid off faster. So that's another big one.
I don't want to put you guys on the spot, but is your student loan north of $500,000 or south?
I'm South.
Mine's south.
Going back to what Trevor said, we are all super fortunate because we are part of the Idaho program. They have this program with Creighton where we essentially get half of our tuition paid by the state of Idaho. So we are in the lucky group to be south of 500,000. I think we were probably all more in the 200,000 to 300,000 range still. But I know we have classmates that were, north of 500,000. And, Riley mentioned the other day that he's got a friend that's north of $1 million between all of his stuff going on from coming out of Midwestern, right, Riley? Is that right?
Just the
Yeah.
student loans.
Yeah.
Yeah, that's
That's
good.
a lot.
So
I mean,
yeah.
I can imagine a mill, even 1.5, practice debt, student debt, throw a mortgage. Like I can probably like see that, but oh my God, like just student loans.
Yeah.
Oh,
That's
that's
wild.
rough. All right. Any other misconceptions?
Riley, did you have something? Sorry.
No, you're good.
Okay. Um, yeah, I was thinking about just one of the misconceptions that I've thought about is that, and this is going back to what corporate offices kind of prey on alongside the debt, is that you need a lot of experience clinically to be able to run a practice. And I did my first year under an awesome mentor clinically, which was great. But I don't think that it's as much experience as they kind of uh, promote it to be that you need to. Um, Obviously, Riley jumped in faster, and he might have some thoughts on that. But yeah, I would say that's kind of a misconception that you need all this experience or you need time working as an associate. I've heard like 3 years, 4 years before I'm going to go work as an associate for the next 4 or 5 years and then think about private practice. And I think that's definitely a misconception if you're motivated.
I think they take 4 years to teach us how to do a crown prep, right? And that's kind of crazy. But with all of that time, if you're taking time and you're learning how to communicate well and how to look at numbers, which most dental schools to my knowledge aren't teaching those things, but if you're finding resources like podcasts and books, then you don't need to wait 4 years after dental school in order to jump into something like this.
I think it also depends on a school. Like, I don't want to beat the dead horse, but everybody's piling up on NYU, right? So if you went to NYU, it's like you haven't even done a crown. Like maybe you did one filling. And I again, I don't know if it's true or not, right? I don't want to sound like, hey, but if that's the case, what do you do? Like, and especially you guys went to dental school during COVID. Like, did you have to do remote fillings?
We got lucky. We were kind of on the tail end. We were doing a lot of remote classes, but we did have like people a year or two ahead of us that kind of got the short end of the stick. Like you say, during COVID, they didn't get nearly as many reps, and so I know a lot of those guys. Yeah, to your point, Tiger, they came out not feeling confident, even just extracting a tooth or. There were a lot of things that they didn't feel as comfortable with, and so yeah, I think you're spot on. It depends on your experience with schooling, and then also a lot of it's just what you make of it too. Like the four of us, it wasn't uncommon for us to be like timing each other or timing ourselves in the sim lab, not on real patients, but on simulation
On
patients,
each
and
other.
seeing how fast can we do these crowns, and like to a good standard too. Like they have to look good and be functional, but we would, time ourselves. And so, we were, it wasn't uncommon for us to do something like that every once in a while and work on our skills, outside of our, what we were getting just by being, passive students, if you will. But
Yeah. Tyler, we're talking about the one misconception that Trevor brought up was the clinical skills when you graduate from a dental school. Riley jumped in right away pretty much and started a practice. Some people say you need 3 to 4 years to get your your hands comfortable with doing the dentistry. And we just talked about that. It might also depend on a school. Some schools historically have not been very strong on graduating dentists that even do know how to even do a feeling, right? So like, or root canal stuff like that. I mean, a root canal is probably not a good example, but like a crown. But like, do you have any take on that?
Yeah, there's probably a lot of people who shouldn't do it for 3 years. No, I'm just kidding. Here's what I will say. Like, I worked for about a year before buying a practice, and there's never a time where you're going to feel like you're all the way there. So I jumped into this practice, and when I first started, they were seeing a lot of Medicaid, which means there's literally unlimited teenagers who needed 3 surface fillings on every single tooth in their mouth, plus their wisdom teeth removed and probably a root canal or 2. And I'm seeing this every single day. And so there was a lot of days in the beginning, we're not seeing Medicaid anymore, so my hands work again. But I would literally do 35 fillings in a day, 35, 40. And I'm really glad now that I did it. I didn't really get paid much to do it. But after about a month and a half of doing that, I was like, hey, I know how to do a filling now.
Yeah.
And that was after dental school, going on all the external rotations in dental school. I think I did like 200 or 300 class 2s on external rotations in dental school, which is probably a lot more than people would ever get in dental school for most people. Working for an entire year, and then like a month of doing 20 to 30 class 2s a day, all of a sudden I'm like, okay, I can predictably do a 2 surface, 3 surface filling. And so, yeah, huge misconception that you have to be ready to do it before you buy. If you wait till you're ready on any part of it, you're never going to do it. So you just got to jump in with eyes wide open and get after it.
Yeah. And I don't think any of us are saying that you should hop into something without clinical experience, but
You kind of saying, Trevor, like you kind of pushing people, like don't waste your time. Let's be honest. Buy the
but
freaking practice. Let's go.
you can condense time. It's not something that needs to take as long as maybe a corporate office will tell you that it needs to take.
Yeah. Did you guys have to do any mission work? Like, again, the 2 things I always talk about, like, I have a lot of great practices using Zen. And when I go visit them, the one thing that comes up all the time, number one thing, they say, in order to be successful as a startup, like, I don't know about acquisitions, but the startups, you have to take emergencies. You have to know how to do extractions, and you need to know how to do root canals. Like, you can't refer this out, at least as a startup general practitioner. You have to learn these things. And then my buddy Aaron Nicholas, who's a doctor who's retiring, right? He's the what is it called? 1 hour 1 hour root canal course or something like that. He's like, that's all I do. I teach young dentists how to do a root canal within an hour, or how to do like a molar prep within an hour, and things like that. So did you have to do any of this? Did you have to go and take the like a more extensive classes or mission trips to get comfortable, or it was just through the dental school and then the like associateship?
I did a root canal this last week, and I think it took me just over 2 hours. So I am not there yet. So I'm still working on it. I would love to take that course. It's on my
Talk
list.
to my buddy Aaron. You would love that. He's old school. I love him.
I've heard good
So I'll
things.
send it your way.
All right.
I think it's huge though, like that Riley still did it, right? So many people would not even try anymore, or
Great point.
you can still
Great
make a root
point.
canal profitable in 2 hours. Like if you're willing to do the crown prep that day and do the root canal and do a good job in 2 hours, that's still going to be, for most general dentists, a great production boost. I'll just chime in again. Like I said, we just cut Medicaid, and so our schedule went from being double hygiene, double book doctor, just super full all day, every day, to overnight. We were like 2 appointments a day, super open. We upped our marketing a ton. And now, like I was just talking to Trevor last night, like it's kind of stressful right now because every single day I start the day with an empty day. But every single day, just like I went and cemented that crown, we fill the day with emergencies. And so I feel really blessed, like our marketing's working. We're having people come in on these emergencies. But if I couldn't keep the extraction, if I couldn't keep the root canal, then I'd still just be doing 5 limited exams per day and producing $600. And
Nothing.
So I think there's something to that. I didn't ever do a startup, but it kind of feels like it right now just because we kind of clipped a lot of our patients. And if I couldn't do a root canal or an extraction, I would have probably gone bankrupt already after like a month and a half. I think it's super important. There's a lot of good practices that don't do any. As far as training goes, I don't know. We can talk about Creighton again. Like, we all were blessed to go to Creighton where there were no specialties, and so there's some people that still complain about it for whatever reason, but we kind of just tried to put our heads down and do.
Why would they complain?
Oh, because it's hard to get stuff done, but if you're willing to work for it and, I don't know, talk to the right people, know the right people. Got to do a lot of root canals. Still learning how to do it better, but there's some dental schools where they do one root canal to pass their board and that's it. And we had to do 12, I think, minimum to graduate. So I'm sure there's great ways to learn it if you didn't get to do it in school, but I could see how it'd be really hard to make that jump where you're practicing on real patients in your practice. I wouldn't want to be doing that, I don't think.
Any other thoughts on that, guys? Trevor, you're thinking.
Yeah, I was gonna say, as far as training goes, yeah, we didn't have specialties. I think all of us did stuff even outside of school though to try and improve our skills. Curtis talked about timing, trying to get more efficient. I remember days we were up in the sim lab, timing our crown preps, and then we would pass them around our little group and just look at them, analyze them. How could we do it better? Can we get a smoother margin? Just things like that. And then as far as mission work goes, like we had after school clinics, and I can't remember if these guys were involved in that or not, but I was involved in that after school extraction clinic that we were doing. We just try and find ways that we could keep doing more dentistry and learn more outside of school. And I think that honestly is probably more of a mindset than anything. It's just that we knew that we wanted to get into private practice. And so we knew that we weren't, wanting to spend 3 years learning. And so before we made that jump. And so we utilized our time to increase our skills. Curtis and I went to a implant. We went to Colorado Surgical Institute as students and shadowed there, and then Pathways, and yeah, we went to a few different places to just try and get out there and see and shadow. And I'm not like these guys. I didn't spend a lot of time doing the root canals as much, and then in my practice, I haven't done a lot of endo. They're getting me back into it. I've done some singles recently, but but yeah, I focused more on implants and extractions, wisdom teeth, stuff like that, and that's what my year associateship kind of focused around as well. And so, but having that, just that, not even the root canals, but being able to extract teeth and place implants and do some of those extra procedures has really helped our bottom line, just especially when things start to slow down and you can throw in a case like that really helps. So
Totally. Yeah. And to kind of add to that and also bring it almost full circle here, we were kind of talking about how, the misconceptions and if you can actually jump straight into ownership outside of school. And I think Tiger too, one of the big things is it comes down to knowing yourself and knowing what you personally need. Tyler's a prime example of just getting out there and like, has he done it before? Maybe not. Is he going to learn all about it and then go and do it really well? That's exactly how he does it. Like if there's something that needs to be done, Tyler's going to go and research it, and then he's going to go freaking do it, and he's going to do it really well. I, on the other hand, am a little bit different. Like Tyler said, like Trevor said, we went to the implant course in dental school. And then even after that, my associate position, it was very geared towards implants and full arch stuff. Tyler does that kind of stuff, and he hasn't even like done it under like a mentor necessarily, but he can do that. Myself, I'm one of those where I've got to kind of have somebody kind of hold my hand through it a little bit and show me. And so that's kind of what my associateship was that first year out of school. And like I say, it comes down to knowing yourself, knowing what is going to move the ticker for you, and then just going out and getting after it and making things happen so that you can, progress and be better each day. So
That's pretty cool. Riley, anything else to add to this?
Nope, I like it.
All right. One of the other things I wanted to ask you, regrets. So now you're owning the practices. And I'm sure there's a day in Riley for you in the last 8 months that you're driving home and you're like, oh, no, I don't know, like this whole thing. Like, what, if you could share, are there any regrets that you had so far? And it could be like, we're all humans, right? Like, you could have a regret that's a temporary, and the next day you're like, what do I say? Like, it's not a problem at all. Like, it's fixed, done. Maybe some of those, and maybe you do have someone big, and you're like, I should have not done that. Like, I don't know, hiring or firing somebody or things like that.
Uh, yeah, there's been a lot of growing pains. I texted these guys on Thursday actually, and I just said like, man, like this week really sucked, guys. I need you to pick me up here, and I'm in a much better mood this week. So, which you just need great people around you. As far as regrets that I've had, I think early on I didn't know kind of what services I needed to hire on as far as different things like credentialing or billing um, and I don't know. There's probably some books you could read about that, but I learned by messing up, and if I were to do this again, I think I would interview companies a lot differently and look for specific things based on how things went. So just a bunch of little things that I've learned in messing up. So
What was like the most expensive mistake? Like, if you could put a dollar amount to it.
uh, it was probably credentialing. I had a lapse in insurance, and then also fired the previous front desk girl in the first like 3 months. So the first 3 months, we probably collected like $15,000 to $20,000, which is not enough to sustain a dental office or a family. So I don't even know how much. And luckily, we were able to kind of catch back up on some of that stuff. But like monthly, we should have been closer to like 50,000. So that was I'm sure we lost quite a bit there.
So it's like roughly, if you should be at a 50, 3 months, that's 150. But you collected, you said total 15, or each month was 15 for 3 months.
It was probably around a total of 15 to 20,000 for a total of three
So
months.
you lost like 130,000 roughly.
Yeah, I don't know how much of that we lost or we just got back delayed, but I'm sure we lost a significant amount there. So
100.
it could be hopefully not that much,
Let's
but
go. I love that. Put a number to it. 100,000, Riley. Let's go. That was a costly
A
mistake,
hundred
but
thousand mistake.
could you call it, like, let's stay on this. Could you call it a mistake? Like, did it teach you something that now you know how to dive into collections and actually see how things work? Like, could you say that you just paid 100,000 for an MBA?
yeah. I'm sure I'm still paying for it, but I've learned a lot about that, and I've learned that I can't just leave insurance and collections and AR to someone up front. That I have to, I can delegate things, but we have to sit down and I have to understand. I have to understand those things to their level.
Yeah. I feel like it's so easy. And I'm glad that you guys are like, I know it's an expensive mistake, but sometimes you need like that kind of expense to hit you in the face to be like, I actually have to do it, because it's so easy. And I mean, I've seen it over the last, 17, 18 years, but you guys see it too. For someone to say, Curtis, don't worry about it. I got you. Like, I'll go do it. You go do your dentistry. Like, you focus on that thing. I'll go collect. Like, don't worry about it. And that always bites you in the ass. Like, it always does. Just no matter what. It could be like we talk about embezzlement, But we also talk, but it doesn't have to be that bad. It could be just as simple as somebody making a genuine mistake, like they didn't know, but it still could cost you a lot of money.
Yep.
That's awesome. Anybody else?
I've got a kind of funny one. When I bought the office, you just never know what you don't know, right? So I thought I'd done due diligence, thought I'd checked everything. Turns out I had no idea what a vacuum or compressor was, really. And so it was only about a month and a half in that all of a sudden I had no pressure in my any of my lines. My air water syringes weren't working, my high speeds weren't working. And come to find out, there's a crawl space under the building. Didn't even know it existed. Never saw it before buying the practice. It's like 2 feet tall, gravel, spider webs everywhere. And down in the dark recesses of the crawl space is this ancient air compressor. And so I had the technician come out and look at it with me, and he's like, "Oh yeah, if you flip this valve, then like see how long it takes to get up to pressure. It should take like 45 seconds or whatever." Like 25 minutes later, it's still not a 40 psi yet. And so that was a $9,000 mistake, was not having a clue what an air compressor was. So we had to get a new one, have it installed. It put us out for 2 days. So it ended up being a lot more than $9,000 mistake because we lost collections, I think, for one of those days. Anyways, yeah, that was at the time, it was the same thing. Like that first month, I think we collected about 18,000. 10,000 of it went to the air compressor.
That's crazy. Anybody else?
So Tiger, I've got a bone to pick with Zen 1 because my certainly this is not my most expensive mistake, but it's the silliest mistake I've made this whole time. And it isn't Zen 1's fault. I'm kidding. It's really my fault for not being very diligent in what I looked at. But I thought I was getting an awesome deal on some surgical blades, and turns out I was getting a super crappy deal on one solo blade. I paid $15 for a single surgical blade. It was $3 for the blade, and then the rest was in shipping. And I thought I was getting an awesome deal, and I was looking at all these other ones, and I just overlooked the one and didn't realize, if a deal's too good to be true, then it's too good to be true, and I should have known that. But
I need to look at the history and see what was the blame. I probably need to look into it.
I'm kidding. Like I say, it wasn't a Zen 1 thing. It was a me thing. I think I was getting too excited about all the number. I was like, yeah. Anyways, but on a more serious note, to go back to your original question about regrets, I'm still in I guess we're all still in that early transition mode. But being a month and a half in, literally the first week, I was asking myself every day, like, why did I just buy this practice? Like, what in the world am I doing? And so I asked myself that literally every single day that first week, thinking like, oh, this is going to go to pot. Like I'm not going to be able to get this thing up to what I thought. And it's just, I think it's kind of a pretty typical thing in lots of ways, especially when you're buying a practice that historically has only done 500,000, as an office every year. And that's what they were doing. And so I was used to seeing a lot bigger numbers, even in my associateship. And you have to go in realizing that you're not just going to flip it in one night. And I knew that, but I think I had more hopes of being able to flip it a lot quicker. And being there for that first week was a big game changer for me, realizing, hey, this is going to take some time and effort. And, being a month and a half in, I'm super excited about the potential, but I am having to be patient with myself and say, hey, we're working hard, but it's not going to happen overnight. It takes some time and effort for sure.
That's pretty cool. Patience. Yeah. That's hard.
I think it probably took me 4 months to stop asking myself that. I still ask it some days, but it was probably 4 months before it was fewer days that I wasn't asking myself that question.
Yeah.
Trevor?
Yeah. As far as regrets go, I don't really have a lot of regrets. I look, I don't know, it's kind of the mindset that I've had coming into it and into practice as well. But I see these mistakes as an investment. sometimes it's a very emotional investment because you know it sucks while you're going through these things. But I'm glad for the mistakes. Like I'm glad that I've had them, because I think that it's a much faster way to learn than not making mistakes. Even though it sucks, but um, I looking back though, there's things that I wish I would have taken more advantage of. And those things are just like mostly to do with leadership. I wish that I had spent a little bit more time developing myself as a leader before I came into a practice and leading a team. That's probably been um, the one part of my practice that's been the biggest learning curve for me, is just how to manage people, how to communicate things in a way that people are motivated about doing them, and negotiate, kind of wade through some of the emotions that people have and the reasons that they have a hard time understanding. Or I don't know, there's just so many different factors to communication and leadership that you have to work through as a business owner. And I think that if I did it over again, I would spend a little bit more time doing that,
What would you do though?
developing that.
Like what? How do you envision it?
um I mean, I know there's been opportunities in my life where I've had opportunities to be a leader and not really taken advantage of those. So I think that would
Can
be
you
a
give any
way.
examples? You're like,
Am I being vague?
yeah. I have questions. Like you talk about certain people on the team, like name the position. Is that a hygienist? Like, or leadership position?
Oh, like
What
emotional.
is it?
Okay,
Yeah.
okay,
What
okay.
is
Throw
that?
under
All
the
right,
bus, dude.
I'll give you some specifics. You want like
I
juicy?
don't want
I
to put you
got
on the
you.
spot, but like I want some stories, man. That's what I'm collecting. Stories.
Okay, you want stories.
But don't put yourself in the spot. Like that's not my
No,
goal.
you're good. I can't think of a specific example as far as leadership goes, other than like in my associateship, there were times that I had the opportunity to step up and correct people, um, and didn't, probably. Like
Like
could have
what?
been
Someone did
more.
something wrong? Yeah. Like what comes
Yeah,
to your mind?
just like, I don't know. I've always been kind of a laid back guy. Like I'm not really one to get after people for not doing something a certain way. So,
You're
um,
not like Tyler.
yeah, yeah.
I went one of my entire associateships for 9 months without ever telling the assistant to hand me something the way I wanted. So
That's exactly the
I'm with
same
you.
way I
That
am.
first day of my practice, I was like, I gotta show up and do this today, and I don't always do it. But anyways,
Yeah,
yeah.
that's a good example. Like, yeah, uh, or like how an assistant talks to a patient. I mean, there's just little things you pick up on. Now, as far as stories go, um, I would have to think about that one for a second, probably. But
But wait, why are you thinking? I think you're bringing up a good point. Those
yeah,
that would listen, um, and maybe they're still associates. Like the good point on this is like, don't waste your time. Don't just show up, do the feeling, and leave. Use the associate as your lab. Like if the owner dentist allows you to go as much as you can, like look at the numbers, run the morning huddle, like I don't know, pick up the trash. Like where's the trash bin? Where's the air vacuuming freaking compressor located? Like can I go see it? Do we get the 40 psi? Do we get less? Like all that stuff you can do for free while you're an associate.
yeah,
Go talk to front desk and be like, yo, how does insurance work? Teach me.
for
Yep.
sure. Yeah, and take note of the people around you that are doing it well, and take notes on what they're doing.
Yeah.
Um,
The only problem with that,
accurately.
I think, if you do that, then the owner doctor would be like, "Whoa, you're gonna have to buy my practice now because you're too good."
Yeah. Um, okay. So
Story.
the most stressful time I've had in my practice so far, and I've only been in 5 months, so I really haven't made a lot of expensive mistakes or anything, but
Not yet.
I did have a yet. Yeah, I will. Um, I did have a time when my office manager, who's amazing, she's on the ball. She does a really good job, but she kind of had some family stuff come up, and so she was looking at resigning and actually handed me a resignation letter. Um, and that same that same day, I had a hygienist call out, and so I was doing hygiene that day and thinking about how I'm gonna cover everything. And so that was a stressful time. Like,
Okay, since you told that story, I'm going to break it
yeah,
apart. What
go ahead.
happens? You go from up one to up two. You got to do the hygiene check, and in that moment, your office manager is like, "Here, a
It
resignation
was
letter." Or how
earlier.
did that happen?
It was I think the night before, and then I got a text at 4:30 a.m. that said that hygienist is out sick. So she's my only hygienist that Monday, I think. Yeah. Anyways, we had a whole call and we had to figure out what to do. Some of the patients we ended up rescheduling, but a lot of it I did some cleanings, I did a lot of probing, and yeah, sent me back to dental school there doing some hygiene. But I also had a full column of my own to manage, and so that was a stressful day.
By the way, one of my very good friends in Chicago, he's a very successful practice owner. Him and his wife, both dentists. He did his own hygiene for 10 years. I'm not saying you should, and I'm not saying you shouldn't. But when people say, well, my hygienist threatened me, I'm like, I know this guy who's doing the hygiene checks for 10 years. Like, and he was thrilled. And when I talked to him, he's like, Tiger, I don't have a problem of like converting people to procedures. Like zero. I do their clinics. They know me very well. And if something comes up, I tell them what needs to be done. It's an immediate yes. I don't have a problem with that. So again, I'm just leaving it out there.
Yeah, no, that's a good point. I'm glad I don't do my own hygiene, but um, but that's good for him.
Yeah.
um, So, and then as far as leadership goes, just to kind of finish that story off, I think that there was a lot of stressful moments in the beginning when, because of the situation that I came into, the doctor that I bought from, he actually was running the practice remotely. He lives out in Alabama now, and he had an associate in, and then this office manager. She was kind of running the practice, and so for context and to finish the story there, it was pretty stressful to come into that situation not too long after I had bought. And then, when we kind of worked things out, there was a period where we were trying to mesh our own ideas of what the practice was and what it was going to be. There was kind of that feeling out period where, um I think I let some of the vision stuff slide because it was her vision, and then like I didn't really want to like implement mine, and so there was some of that as that specifically there. Just kind of figuring out where her role was, her new role, and where I needed to step in and be more of a leader. So I don't know if that's specific enough
No,
for you,
that's
but
pretty cool. It's just
cool.
stay true to your vision.
Yeah. Yeah.
Yeah.
Trevor, what did you end up doing? I never really heard the final details because you've got her in place still. She's a rock star and does like a ton of awesome stuff. What did you end up doing to keep her on board and to like keep that going forward? I never heard.
Yeah. So she's remote now on Wednesday through or Tuesday, Wednesday, Thursday. She's in office on Monday. She comes in for team meetings, and then she does a lot of stuff behind the scenes as well remotely. Puts together a lot of our marketing stuff. So she's still involved with the practice uh, in a good way. But roles changed, and so there was kind of that. I think that she was learning to let go on some of that stuff, and I was having to take over, specifically on like team leading the team, um, being the one that's like, okay, we're not going to do things this way, we're going to do it this way. uh Verbiage, presenting presenting treatment to patients. Yeah, what our schedule is going to look like, just things like that we were negotiating and kind of moving around. But to answer your question, Curtis, she's remote now, but she's still really involved with the practice. So
Nice.
it's been good.
Yeah. I remember when we started Zen, it was back, 2016. And back then, software companies were popular. Everybody was doing all this really fancy stuff with their employees where, like, everybody's a leader. I'm trying to remember what else. Like, full transparency, that was my favorite at the time. Like, you have to show everything, tell everything. And there were so many things right around that time before COVID. It was kind of leading up to it that right around COVID, I felt like I'm not even running my own company. It's like there's so many ideas around what Zen should be, and it's not even me, but I have all these people that are kind of run. Like, I think what I'm trying to say is I can relate a little bit to that because, again, it's not a dental office, it's a business. But however, it is a business, and I can see where I was probably right around your age when I was starting Zen, and you're not exactly sure like what and how it needs to be done and what you want to do. Um, and the crazy part for me was to learn that, like, the more you have the ability to step back, think 5, 10 years ahead, get excited about that vision, and then just stay true to that. And I think what I've learned over the years is it's so hard to go by whatever is popular at the moment and not be true to yourself. Like, for example, um, it took me a while to be very firm on the fact that our company is very pro family. Like, I love hiring people with kids. Like, I think it's an amazing thing. Like, we do so many certain things to support and promote that, to the point where it got uncomfortable to some people that didn't have kids, because we do talk a lot about that, right? And so at first, I'm just giving an example. We were driving a company in a way that it was kind of like amorphous to everything and everybody. And at some point, I had to pull back and say, no, like, most of the top people have kids. Like, we talk about that. We feel comfortable about that. We're upfront about that when we hire people. And I don't think it's wrong. So if it's not the right place for you, like, I can help you find another position, and be firm about that. And so that took me a lot of years to get to that point and be comfortable with it, because, like, if my daughter is not feeling well and I'm the one sitting home with her, like, I don't have to feel bad for my team. And the same thing with my team. Like, they don't have to feel bad about it. So again, I'm just throwing it out there that it's really, it takes time to get to that level. Like, and it's not happening like every day, or like there's no leadership course you could take. I took a lot of them, and it's nobody talks about that. Communicate as simple as possible, and stay firm to your ideas. Like, if that's what you want to do, and people have a choice, and the more clear you get, the better. Like, this is what I want to do. Like, if you like it, great, let's go do it together. If you don't, I'm sorry.
Yeah, those are great points.
Yeah, I love that.
I had a thought come up. I think almost every single day, something happens where I have to tell myself, like, okay, time to go be the leader. I have to, like, give myself this little pep talk and then go do that thing. And one thing that always comes to my mind with that is it came from a lifestyle practice podcast with Steve Vandegraff, clear back our first year of dental school, and he was talking about this concept of eat the frog. Does anybody remember that?
Yeah.
There's going to be something every day that you don't want to do, but you have to do. And for me, like 9 times out of 10, those are leadership things. And then there's 1 time out of 10, it's clinical. But almost always I'm just like, okay, we just got to eat the frog. Like, I'm going to walk in. The first thing we're going to do today is I'm going to sit down with Janice and we're going to talk about this phone call yesterday or whatever it is. The story that came to my mind was that I was doing these team meetings every other week. We'd put an hour aside one morning, and I hated it, and I still don't love it. It's probably my least favorite thing we ever did, was have these team meetings. And I'd sit down, and a lot of the time it would be like, okay, we're going to talk about, I don't know, like answering the phone today. And we get all these ideas, and all of a sudden everybody's pointing fingers, and everybody's arguing, and you're not doing this, and you're not doing this, and I want to do it this way. And then eventually I just canceled all the rest of our team meetings that were pre-planned in the schedule. I was like, I'm not going to do this again until I figure out a better way, but I didn't know a better way or how to figure out a better way until probably like 2 months ago. I was doing my first round of one-on-ones with my employees, and story for another time, but I replaced my entire staff within a month of taking over, besides one assistant. And one of the girls I hired for the front desk is almost 60. She's been in dental for like 40 years. And as far as like knowing how to run an office, she knew way, way, way more than I did. As far as like having the vision of what I wanted it to be, obviously that was not her. I had more experience there, but she had way more experience of how to make it happen. And so I decided for our one-on-one, most of the other employees, it was just kind of an accountability thing, and how is this going in this, and you're going to tell me how you're doing, and I'm going to tell you how you're doing, and we're going to talk about it. But for her, we did a little bit of that, and then I just was like, okay, I'm just going to ask you a whole bunch of questions about what you think and your opinion and how you've seen this done and how we could do better. And one of the things I asked her about was, how have you seen team meetings be effective before? And I think for a second it kind of caught her off guard that I was asking her, and it did have to, like, I had to kind of humble myself, you know. And she says to me, Dr. Marlowe, you have to show up to the meeting and tell us how you want this done and train us how you want it done. And somehow that should have seemed really obvious to me, but up till that point it wasn't. I was taking much more of an approach of like, let's hear how things are going and what ideas you have, and then maybe we're going to arrive at a solution during the meeting. And that was horrible. And so after that one-on-one, then I went back to my vision. I'm like, how do I want these couple things to be done? And I got to define that and figure it out and be the leader and figure it out. And then we had a huge team training just this last Friday. We did a 6-hour training, and I showed up with an agenda of, this is how I want this to be done, and let's train on it, and let's role play, and let's talk about it. And it was awkward, but it was awesome. And this week went so much better. And I got to the end of that training, and I was like, that went so well. Why? Because I decided to be the freaking leader and actually teach something instead of just showing up and hoping everybody else was going to solve the problems. And it took me having to ask someone who knew more, you know, and maybe I wouldn't have done that in front of the whole other team. But I guess the one good decision I made was to have the one-on-ones. And out of that, I learned a lot. So
That's awesome.
I don't know, you just have to be the leader. And it's so hard. Every day I go home to my wife, I'm like, dentistry was fine today, but I had to be the leader. And there's things I got to be the leader on tomorrow. Got to learn more.
That's a cool story. That's awesome.
That is awesome. That's great. Yeah, at the end of the day, Tyler, you bring a good point up. I think that, you know, the people that we have in our offices, while nobody's like, you know, Trevor and I joke about this all the time, and I think most people know, you know, the typical assistant, typical front office lady, typical, you know, they're just high school graduates usually. And so it's like, but that said, they have a good heart and want to work hard generally. I think most people do want to do that. But at the end of the day, like Tyler says, we have to lead them, teach them, show them exactly what we want, and then they can go and do it. Otherwise, they feel lost and, you know, unsure of what exactly to do. And it's really easy to just kind of twiddle your thumbs if you don't know what to do. And then from our perspective as owners, you're like, you suck if you're not even working. But at the end of the day, it's just, no, it's on me. You know, it's the extreme ownership mentality of, if something's not going right in practice, then it's, you know, something's going wrong with the way that I'm leading the team, and I gotta figure that out. So yeah, I like that, Tyler. That's good.
That's what I was telling in the beginning too, right? Like when it was so popular that everyone is a leader, like that terminology, especially in dentistry, is like, oh, like you team, like, no, they're not. Like, if you're the leader of the practice, in my mind, that means you're the one who's going to eat shit when things are bad. That means the buck stops with you. You're the one. If the practice goes negative, you're not going to look around and say, you guys are all leaders, right? Nobody's going to get paid today. No, you're going to find the money, pay everybody, and not take the paycheck. Like, that's how it works. But you signed up for that. Other people came to you, the practice, to work and provide the services and follow the leader. So it's like, it doesn't mean that you can't build the units, right? So for example, clinical, right? So dental assistants, maybe you have 4 dental assistants and one becomes later the lead dental assistant. And you could ask her for opinion and say, look, how do we run the dental assistants better? Like, how do we assist? How do we do this? Like, how do we do the trace? How would we sterilize? Like, what's your opinion on that? Because you, as a doctor, may not know. But like, to expect the dental assistant to know how to welcome patients when she's only welcome patients in your practice and you're learning from everybody else, you clearly have more ideas on how to do that than you're just going to come in and implement. Like, it's just totally different thing. So it's amazing. Like, your story is awesome. Riley, what do you think? You're too quiet.
I'm just soaking this all up. I think kind of going back to, I can't remember what you asked me originally, but I think learning how to prioritize, what really matters has been the biggest learning curve. Getting the right people, making sure the right people are in the right seats, making sure you have a vision, making sure you're implementing the vision. Those are all the big picture things that I think coming in, I didn't know was the big picture. But that's a lot of what we've all been learning.
Yeah.
That's awesome. Any, I think one of the last things I want to ask is, are your inspirations? Like, who are your inspirations in dentistry, outside of dentistry? Like, who do you aspire maybe to become, or role models? Like, just curious, like, what's on your mind about that?
Yeah, that's a good question. So cheesy answer, but super true. Thanksgiving week, I am extremely grateful for these guys here. Like, every single one of them has brought something to the table. Like I said from the start, I'm a big moocher. Like, I sit by the wayside and just learn from these guys big time. So, there's that. And then on top of that, I mean, I'm also a big, and I did a lot more of this before getting super busy with ownership, but a big podcast guy. Like, I love listening and just kind of gleaning as much as possible from some of the big wigs, whether it's like Mark Costas or there's the Dental Practice Heroes podcast with Paul Etchison. There's so much good information out there. It's unreal. And like, you don't even have to pay for most of it. And so I've been a big time benefactory of just the free podcast stuff and learning things. And sometimes all it takes is just picking something up on your way to work and then implementing it the same day and just trying out new things and being willing to go that way. So I don't know, that's something that comes to my mind. But.
Yeah. Yeah, I'm the same way as Curtis. I'm sure we listen to most of the same podcasts. We talk about them all the time. Probably all these guys. We having this group has been super beneficial to me because, like Curtis said, all these 3 guys, as well as some of our other classmates that are really good friends and doing amazing things as well. They inspire me every day to try different things or be better as a leader. I'll hear them succeed or fail in something, and even in the failures, it's like we're all teaching each other, and so that's been huge. One of I would say that uh, one of the things that really changed my mindset, probably the trajectory of my career as well. When we were in Idaho, our first year, uh, there was kind of a sentiment that you had to do really well in school and you had to specialize to kind of have a lot of success. I don't know if you guys felt that. I felt that. Um, and the debt and as well. And so there were a lot of things that were kind of going through my head in terms of decisions and how I wanted to proceed in my career. And I found the Lifestyle Practice podcast and reached out to Steve, and he agreed to meet with our class of 8. And so that was amazing. Like that opened my eyes to see that someone, could go into private practice as a solo doc and hit incredible numbers. I think he was making $1 million at the time that he talked to us take home. And so, that totally opened my world. And I still listen to their podcast. It's there's so many good things in there. As far as inspiration and just little nuggets that you can take and implement. But yeah, I mean, Costas, Luna, Dental Practice Heroes podcast with Paul Etchison. Those are a lot of the ones that I listen to. They're kind of my inspiration. As well as I had a really good mentor. His name's Jared Flitton. Shout out Jared. Um, he was awesome. And he taught me so many things, and he's continually an inspiration in my life. So, yep.
That's so cool.
It's kind of been fun. Jared's mentor, or Trevor's mentor, Jared, kind of became a mentor to all of us. We got to meet him, and yeah, my practice is kind of a hybrid of Scott Luna's model and Addison Killing's model, and then 25% the things I learned from these guys that they've done right or that we've all done wrong or whatever it is. So I go back to that same thing. I remember when Trevor set up that meeting with Steve Van de Graaf, and I was just like, who is this guy? I talked to them a little bit about it, but that must have been like our third month in school or something.
Yeah.
Same thing. Completely changed my mindset, outlook, thoughts about what the career could be. A lot of people would probably look at us and say, why didn't you specialize? And it's because we had that vision of what it could be to be a general dentist and do really well. And so I always go back to, I was like, man, Trevor and Curtis, those were the guys that first year that even gave me that thought. Otherwise, I would have never thought about it. So, but yeah, there's a lot of free stuff out there, and I don't know, especially Addison. He's been awesome for me as a mentor, and I think Riley would probably say the same thing. I know he's talked to him a lot too.
Yeah, you guys talked to Addison? Yeah, he's pretty cool. Riley, wrap it up for us.
Yeah, okay. I got a good story that'll wrap it up. So I have a lot of mentors that range from historical figures, family members, ecclesiastical leaders. It goes kind of all over the place, just depending on the mood that I'm in, I guess. But I think one of the biggest memories that stands out to me is I remember sitting in dental class D1 year, and our instructor asked us, by show of hands, how many of you guys want to be an owner, want to own a dental practice? And everyone raised their hand around me, and I was like, maybe my hand should be up. Like, I don't know. I don't know what's going on. I'm just trying to pass this histology exam that we have tomorrow. And I feel like that really opened my eyes that there might be something beyond this histology exam. And so going back to Curtis's point, surrounding yourself with people that have the same goals and ambitions, or better goals and ambitions, like I have with these guys, is what will push you and take you to where you want to be.
I think I'm going to call this podcast Beyond the Histology Exam.
Yeah, that's awesome.
Perfect.
That's so cool. Guys, this was awesome. I don't want to hold for more of your time. Any departing thoughts, anything, if anybody as a dental student listening, probably not, that's not typically our audience, but who knows, if you guys happen to put a wisdom in the ear of a dental student, what would you say?
I'd just say dentistry is freaking awesome. We just got done talking about specializing and not specializing, and there's definitely nothing wrong with specializing, but there's nothing wrong with not specializing. And the beauty is dentistry has so many avenues, so many different ways that you can take it, and you can literally you can do whatever you want with your career as a dentist. And that's the beauty of it. It's it's an amazing career, even if you don't become a practice owner. But once you do become a practice owner, it opens up a whole nother world of opportunities. And so I think, that's what I would say is, hey, it's a great time to be a dentist. There's a lot of people out there that talk about the debt and, other factors about why you shouldn't do dentistry. I'm still a big believer in dentistry because I think it's amazing how flexible it is, how you can literally do, the world is your oyster as a dentist.
It's so cool. Anybody else departing thoughts to a dental student?
Just learn all you can. Don't accept anybody else's limitations on what you can be or what you can learn or what you can do. That goes back to knowing yourself and knowing what you want. And I think we'd all agree there's been lots of times where we don't know what we want or don't know what the vision is. But just find that next step. Keep learning.
Yeah, take control of your education, your learning, and sometimes that means maybe skipping a lecture that isn't good. So
I heard there's probably some story there too. Like, we'll pencil it to next time.
There's some good stories there, Tiger.
Oh my God. It's always like this. Like an hour after, you like start unraveling some good stories, and you're like, I gotta wrap it up. Oh my God. All right,
Take
Trevor.
some time.
What do you got?
Yeah, I would say don't be afraid of failure. And that goes back to the mindset I was talking about earlier. You're going to make mistakes. You try and avoid the big ones if you can, but don't let the fear of failure, keep you in a situation that you don't resonate with. I think all of us resonated with private practice, and that's where we ended up. And, I think I found a lot of courage in their actions, these guys. But, don't be afraid to take out the tooth or to push yourself and fail. I've made plenty of failures, and that's been the way I've learned, whether that's fortunately or unfortunately. But I think that too many people probably, don't go after something because they're afraid of the failure. So just recognize that as an investment, just something that you have to pay on the way to success. So I'm sure that you probably agree with that and in your companies and your story, Tiger.
No, I have a few stories too, but for next time. I don't want
Yeah.
to bore you for now, and we can get stuck here. I think we resonate. That's why I really like you guys from the beginning. Like, I talked to every single one of you when you guys signed up, and I saw something, because a lot of stuff resonates. Like, we're all looking at things in a similar perspective, and I truly believe there's nothing better than owning a private practice. Like, I changed my whole company around that whole philosophy. It's like, I don't want to work with DSOs. Nothing against them, just we want to support private practices, and I think it's beautiful. Like, all the stuff that you've talked about today resonates, because to me, it's like the ultimate American dream is not the house with the white fence. It's the practice that you can own. It's the freedom, and you're fully in control, right? So like Tyler today could have just gone home, but he's taking that emergency. I mean, yes, he's doing great by the patient, which would, like, you guys should do as doctors. And at the same time, he's making a living. And like, imagine that multiplied. That's your American dream. Like, that's what you're working for. And I think that's what inspires me at the end of the day. So that's pretty cool, guys.
And some people can look at that as a cage, like the responsibility of ownership. You know what I mean? Like, some people would look at that and say, like, I know guys that are in practice and they like their view is negative. Like, they feel dragged down by being an owner, and so they look to get out of it. But I think that's a simple, switch flip there, that you just have to turn the other direction and say, like, this isn't a cage. This is like freedom if you're willing to embrace it.
Tyler said something earlier that we kind of all skip. I didn't want to go too deep on this. You said within a month you fired everybody except one dental assistant. Like, you know how many doctors out there afraid of firing at least one person, and it's usually either a hygienist or the front office, like treatment coordinator, like terrified. And you just cleaned the house in 1 month, left one dental assistant. It's just like, it all comes down to that.
But it turned out good.
but you did it. You did it, and you still survived, right? So in the practices going forward, you're fine. And I think in dentistry, like there's always like back in the days when I was building dental practices, there was always a red flag to me. Actually, two. One is when the doctor is taking himself or herself too seriously. Like some of my favorite doctors are like they will put Jeff. They don't even care about like how people are like, but they go and they do some of the best dentistry. Again, I'm not judging. I'm just saying like that's what I've noticed. And number two, usually the doctors that and they will park way out there, right? So like usually it's a big red flag for me if you have a fancy car and you park in front of your freaking office. Like I don't want to work with you. Again, maybe I'm judging, but that's not the type of person. Like usually my favorite people, they will drive like I don't know Toyota Camry or Tesla Model 3. They park somewhere out there, but then they have a beautiful life outside of the practice, right? And they manage the two things completely separately, and then that's how they roll. And again, I'm just sharing the experience. And so I think that's you're in full control. That's your little kingdom, or like you can run it how you want it.
Amen.
All right, guys. I'm grateful to you. Happy Thanksgiving. Really excited. Trevor, thanks for putting it together. Like you guys are awesome. Like all four of you are just you're gonna crush it. Just let me
Thanks,
watch it
Tiger.
on the sidelines. Like I'm proud of you guys.
Yeah,
Thanks,
appreciate
Tiger.
it.
Yeah, it was a pleasure to be on and get together with these guys and talk with you. So
Yeah, let's do it
Absolutely.
again.
And we also
Absolutely.
company in your
Thanks
circle.
for all you do. Shout out to Zen One, to you, Tiger.
Great for us.
Super game
yep,
changer for us. So
We
we
love it.
all have had
has
nothing
been.
but great experiences. So thank you for what you do for dentistry.
Thank you. Appreciate it. Means a lot, guys.
Yep.
All right. Thanks, everybody. That's the
All right.
pod.
Thanks.
Let's go.